Day 2 of doctor visits. So, who likes the glare off the top of my head? If it were freshly shaven, it would be really shiny. So let's talk about day 2. I had a prehabilitation follow-up, and it was a good visit. Basically, eat as many greens as I can and eat as many beans as I can. So prebiotics to supplement probiotics, and protein's good food. We didn't talk about red meat, which red meat from the beginning has kind of been a don't do thing. Once a month, I try not to eat it much. Rarely do I eat it, but physically, the doctor says I'm in good shape. She says work on strength training. Feels like my exercise regimen of cardio is good, and just keep doing what I'm doing with that, which is walking. I walk pretty regular, and I do martial arts a couple days a week for an hour to an hour and a half per class. My next visit was a liver surgeon, and he is the same surgeon who I spoke with last time. And he says, I hate to be, well, just to put it out there, I asked the doc, I said, listen, what's the deal? He says, look, everything that you had, I use had as in the past tense. He said, looks like it's calcified and it's treated metastases. And he says, this is a miracle kind of situation. And he said, and I said, like, and I've heard that a couple of times, and I hesitate heavily to put it out there because it's one of those things that in my heart, I know there are people who are suffering. And for me to be so fortunate as to have a miracle kind of response is humbling on so many levels. And talking to him about that, he says, it's like we're in single-digit percentages of this type of stuff happening. He said, and he threw the number 1 out there, and I'm like, my goodness, what have I done that would afford me the opportunity to be in this percentile? Of course, we know the backstory is it could come back at any time. But for all the lesions and tumors which I had, to start in my colon, my lymph nodes, and in my liver, since the last PET exam or the PET scan and the last CT and MRI, everything shows stable or better, and the PET shows no active cancer, and the CT and MRI shows a decrease in size and numbers of lesions that were in my liver. So it's pretty remarkable to hear that. It takes you to a moment where you have to take a breath back and say, okay. But I also try to keep perspective too, because the opportunity for it to come back is there. And I know with strong faith, prospective friends and family that if it did come back, then we'd be prepared to fight it. He gave me some options if it did come back, what we would do. But essentially, he says, unless you just want to, there's no need to come back to MD Anderson right now. He says your oncologist in Nashville is doing a fine job, and let them continue to manage. And come see us when you need us, if you need us. But they're not going to require me to come back to Houston. He said if the situation were grave, yeah, I'd have you come back. You may even stay. But in this situation here, call us when you need us. And it's refreshing to hear that. Followed up with the liver surgeon and spoke to the oncologist. And he put it basically I don't know why you really even need to see me. You've spoken to a colorectal surgeon and a liver surgeon, and they've pretty much given you the short. He said, coming back, he said, call us if you need us. Otherwise, keep doing what you're doing in Nashville. There is a point, though, in Nashville we're going to have to talk about this trial. And I didn't learn this until last week, but the clinical trial that I'm on is scheduled. They told me when I signed up, they said you'll be on this about 2 years. And it's a 35-week assessment or trial, and I'm on week 30 of treatments. I say week 35 sessions of treatment. I'm on session 30, so I've got 5 more sessions of what to do treatment-wise. They said that, there are times when the drug provider will allow the patient to continue on that trial, and because it behooves them to do that, to show the benefits of the trial, and obviously the patient is continuing to do well. So I'll approach that when we get to Nashville. Essentially, though, the oncologist says the same thing. This is a miracle kind of case. Very small percentages of folks have this kind of response. And keep a watch, keep doing what you're doing, and do it. So it's pretty remarkable to be able to have this experience, go through what I've gone through, and know that there are other people who are having such a 10 times worse situation than I am. But it really puts into perspective where to place your appreciation and where to focus your heart. Because if we don't do that, then we lose perspective. So, just on the shuttle ride out of the campground to the doctor's office the other day, was a lady whose husband is having a stem cell transplant that day. And there are so many others like it. As I put it to the doctor there in Houston, the oncologist, I said, there's a whole host of folks that are much more sick than I am. And their time, the specialist time is increasingly valuable to those folks. But I'm certainly grateful to have had that opportunity. So I'll close it again, dream big, live for the moment. Have your faith in line and your perspective right, and we'll all be successful, stronger together. Appreciate you watching these 2 small videos that I've done here in Houston. We're going to leave here on Saturday and head eastward to Destin, Florida, to take a good little vacation and kind of get some cancer off our mind, enjoy the holidays, and do some things we've not been able to do but want to do. So, appreciate you all. Have a great evening.